Namaste, welcome back to my channel. Today let us discuss on restraint policy. Restraint. Any manual method, physical or mechanical device, material or equipment that immobilize or reduce the ability of patient to move his or her arms, legs, body or head freely. In the sense, if we use any kind of a restraint, so it will make a immobilizing of a patient arms, legs, body and head freely. If the patient can easily remove the device, material or equipment, it is not considered a restraint. So, if the patient remove any kind of devices, so that is not considered as a restraint. What are all the purpose of restraint? So, the important purpose is applied for safety. So, safety in the sense it is for the patient safety as well as healthcare worker safety. Otherwise, patient will make a injury. So, to prevent injury, that is also one kind of a purpose to apply restraint, and prevent dislodgement of tubes. So if a patient having any kind of tubes, so if patient removes the tube, so he may go into critical situation. So to prevent that, we used to apply restraint. And in psychiatric setting, we used to apply restraint again to save the patient life. Indications for restraint. Displaying behavior that is putting themselves at risk of harm. So, if we are not restraining the patient, because of their behavior, they may make harm to themselves. So, to prevent that, we should put a restraint. Displaying behavior that is putting other at risk of harm. So, they may make others also in the risk, so that we should put a restraint for them to prevent injury to themselves and as well as to others. Requiring treatment by a legal order, for example under the Mental Health Act 2007. Requiring urgent life-saving treatment. So to give life-saving treatment to the patient during that time, we should use a restraint. If patient is very irritable or is not cooperating for the treatment during that time also, we should make a restraint to the patient. Needing to be maintained in secure setting. Types of restraint. So here you can see the physical restraining to the patient and as well as chemical restraint. So this is the way we can make a restraint to the patient. So what types of restraint may be used? Physical restraint. Physical restraint are devices that limit specific part of the patient's body such as arm or leg, belt or vest. Restraints may be used to stop the patient from getting out of the bed or a chair. So the physical restraints are tying them by using of a belt. Okay, so if we want to restrict the upper arms, so we should put a belt to restrict the upper arms. So in that way, by using of a belts, we can restrict the activity of the patient. In a chemical restraints are medications used to quickly sedate a violent patient. These will be given as a pill or an injection. So in the chemical restraint, we are using a medication to sedate the patient. In the sense, to limit their activity, here we are inducing a medications by form of oral or injections type. And the next one is seclusion. Seclusion is placing the patient in a room by himself. The room is locked and kept free of items that could cause injury. Healthcare providers will watch him at all the time when he is in a seclusion. So this seclusion in the sense we are keeping the patient in a empty room. So there should not be any material in the room, because if we keep any material they may make injury. So there should not be any material in the inside the room, and healthcare workers must monitor the patient activity all the time. The physical restraint are any action or procedure that prevent a person's free body movement to a position of choice and or normal access to his or her body by the use of any method attached or adjacent to a person's body that he or she cannot control or remove easily. So this is a kind of physical restraints. Here you can see the tying of a patient by using belts. So this is one kind of a restraint to limit patient movements, and they will not remove any kind of devices if we tie like this. Okay, so this is a physical restraint method. And next one is chemical restraint. So chemical restraint are any form of psychoactive medication used not to treat illness but to intentionally inhibit a particular behavior or movement. So here we are injecting of a medication to limit patient activity. So the medications are not being given to treat the patient disease, but here we are using to control patient mobility or activity. Okay, so this is another type of restraint by using of medications. So that is chemical restraint. And next one is seclusion. So the seclusion will be used again in a psychiatric setting. So we are keeping the patient in a single room. So in a empty room, and the room will be locked and kept all the time, and the healthcare worker must watch the patient. May used only for the management of violent or self-destructive behavior. A restraint is any manual method, physical or mechanical device, material or equipment that immobilize or reduce the ability of patient to move his or her arms, legs, body or head freely. So once restrain the patient, monitoring of a patient is very important. How will healthcare providers monitor the patient while in restraint? So vital signs such as heart rate, breathing rate and blood pressure will be taken often to make sure they are in normal range. So checking of vital signs is very important when patient is on a restraint to know the patient condition. And the patient physical comfort will also be monitored closely. Healthcare provider will check the patient's skin for injury or blood flow problems under the restraint. They will also give him liquids and take him to the bathroom as needed. So close monitoring of the restraint site for any skin injury and blood flow is very important when patient is on restraint, and also providing a liquid for the patient and assisting for the patient for is like a bathroom as needed. So the patient's behavior will also be monitored. Healthcare providers will remove physical restraint or allow the patient to leave seclusion as soon as he is calm and cooperative. So again, to monitor and assess the patient behavior to release the restraint. So physical restraints can be removed when patient is calm, and finally we can put them into the seclusion, and again monitoring of a patient is very important. What are the risks of using restraint? The patient may become more angry or violent while in restraint or seclusion. So if we apply a restraint to the patient, physical or chemical or seclusion, the patient become angry or violent due to the restraint. The patient may struggle against physical restraints. This can cause skin wound or block blood flow. So if we apply a restraint to the patient, like applying of a belt to the patient to restrict their activity. Due to this, patient if struggle against to the physical restraint, they may get skin injuries or blockage of blood flow. And also it can also increases patient heart rate and breathing rate. This can be life threatening. So due to this struggleness, patient heart rate and breathing rate may increase, and sometimes it will be a life threatening situation. And due to this chemical restraint can cause low blood pressure, heart rhythm problems, and slow or shallow breathing. This can affect how much oxygen the patient gets. Chemical restraint can also cause drooling, shuffled walk, muscle spasm, and stiffness and tremors. So due to this chemical restraint also there are some risks. So that has to be properly monitored by the healthcare workers to reduce again the risk due to the restraint. Thank you.